Welcome to this video on total protein, albumin, and globulin, presented by Dr. Suresh S. Shinde. Key topics we will cover include total protein, albumin, and globulin, the test methods used, and their clinical significance. Serum proteins are mostly synthesized in the liver, and their levels are affected in liver diseases. Liver function tests evaluate total protein, serum albumin, and globulin. Total proteins are vital constituents of muscles, enzymes, and hormones. They are important for water distribution between blood and tissues and mainly consist of albumin and globulin. The Biuret method is used to determine total proteins in serum and plasma. The principle is that proteins bind with cupric ions in an alkaline medium to form a blue-violet complex. The intensity of this color is directly proportional to the amount of protein. Total protein levels are measured in serum and plasma. The normal range for total protein in serum and plasma is 6.0 to 8.0 grams per deciliter. The total protein kit contains a reagent bottle and a total protein reagent, typically 6.0 grams per deciliter. Reagents should be stored at 2 to 8 degrees Celsius. Clinically, increased total protein levels may indicate dehydration, chronic inflammation, or multiple myeloma. Decreased levels are seen in chronic liver diseases, cirrhosis, malnutrition, nephrotic syndrome, and edema. Serum albumin makes up approximately 60% of total body proteins. It is synthesized in the liver, maintains osmotic pressure in the blood, and helps transport drugs, hormones, and enzymes. The BCG method is used for determining albumin in serum or plasma. The principle involves albumin binding with bromocresol green to form a green albumin BCG complex. Albumin is measured in serum and plasma. The normal range for serum albumin is 3.7 to 5.3 grams per deciliter. Albumin kits typically contain an albumin reagent and an albumin standard, such as 3.6 grams per deciliter. Like the total protein reagent, it is recommended to store it at 2 to 8 degrees Celsius. Albumin levels may be increased in cases of dehydration, nephrotic syndrome, and severe burns. Decreased levels are associated with conditions like hepatitis, cirrhosis, malnutrition, and gastrointestinal diseases. Globulin makes up the major part of the total proteins, other than albumin. Globulin tests help diagnose liver dysfunction, kidney issues, nutritional deficiencies, and immune deficiencies. The level of globulin is determined using the calculation method, where globulin equals total protein minus albumin. The normal range for globulin is 2.3 to 3.6 grams per deciliter. The normal albumin to globulin, or Ag ratio, is 1.0 to 2.3. Globulin may be increased in chronic infections, liver disease, or multiple myeloma or lymphoma. Conversely, decreased levels are seen in nephrotic syndrome, cirrhosis, malnutrition, and celiac disease. Thank you for watching this video on total protein, albumin, and globulin.